Good morning, everybody. Here we are on Monday morning. I'm sorry I went on Friday, but interesting enough, I was in St. Louis and I have a better Wi-Fi connection right here in central Missouri. So I had an unstable connection, so I decided not to get on and drive you insane by freezing up and having my audio stop and my video stop. Anyway, so we it was an interesting 2 days in St. Louis. Even though I'm staying in a huge city, um, I had some trouble with Wi-Fi and connectivity. And a friend of mine said, "Well, you're on." And, I mentioned we were on our health and wellness series Thursday night, and I had to go to my phone, so I was connected by 5G. And of course, he said, "Well, 5G might give you coronavirus." So that was Thursday night. It is Monday morning, and I feel fine. So I guess even though I was in the hotbed of coronavirus in St. Louis, I think I'm okay. Okay, good morning, all of you that have signed in. We're going to talk about food intolerance and food allergies. And I don't know if you've thought about this, but food intolerance really is a thing. Okay, so and food allergy can be a thing. I'm not sure that everybody that thinks they're allergic to certain foods really are. Um, I remember flying um, on a trip from Oklahoma City, well, actually back to Oklahoma City, and there was a woman right across the aisle from me who told the flight crew that she was peanut allergic, so they couldn't give out their little packets of peanuts. Well, that's one of the deals when you fly. You get pretzels or you get peanuts, right? So she hiked the whole deal because she told the flight crew that she was allergic to peanuts. So, of course, I decided to test that hypothesis, and I pulled out some peanuts from a different flight out of my bag that I was carrying on, and ate the peanuts. And she was telling the flight crew even her smelling peanuts would give her a reaction. Well, she didn't. So I think a lot of people think that they're allergic to foods, and they may actually just be intolerant. And there's a difference. So that's what we're going to talk about today: is what's the difference between intolerance and food allergies, and how do you figure it out? Is there a way to test for it? And then what do you do about it? Okay. So this one won't be that long, I don't think. There are some testing capabilities for figuring out what you're not. I'm not going to say allowed to eat, but what seems to cause some troubles, and most of those are intolerances. Okay, so food allergy really. So if you think about lactose intolerance, it's not an allergy. It's your body doesn't really like lactose and doesn't have the enzyme to break it down, so your body will tell you don't be doing that. Allergies are really life-threatening. So if you eat something that you're allergic to, you're going to get potentially an asthmatic type response or a severe allergy response that can be life-threatening. So that would be helpful to know, correct? Okay, so what is a food allergy? It's an immune system response. So an allergy really involves IgE, which is kind of the same immunoglobulin that gives you seasonal allergies, like I have every time I talk to you in the morning, which is why I cough, and hopefully I won't have a sneezing episode like I did about 5 minutes ago. Okay, so an allergic response is caused when the body mistakes an ingredient in food, and it's usually a protein. Okay, so it's almost always a protein. And the body recognizes that protein is harmful and creates a defense system or an antibody to fight it. Hopefully, those of you, or if any of you that are listening, have had coronavirus exposure, didn't get sick or fought it off or had mild symptoms. Hopefully, you have developed an immune system response so that if you get exposed again, then you will not be sick. Okay, so an allergic response involves antibodies, usually in food to, usually in the protein. Sorry, not saying that right. Usually an antibody response to the protein that's in food. Okay, so an allergic reaction occurs when the antibodies are battling and invading food protein. And the most common food allergies are shellfish. So you know people that cannot eat shellfish, nuts. So the peanut allergy is a real thing. Fish, eggs, peanuts, and milk. Okay, so that's an allergy. It's an immune system response. It's about 1% of the population, so it's not huge. That 1% is 1%, so it's there. And so what's the difference between an allergy and a food intolerance? So a food allergy versus a food intolerance. So food intolerance is a digestive system response rather than an immune system response. So that occurs when somebody eats something that irritates the digestive system, or when a person is unable to properly digest or break down the food that they're eating. So the most common one is intolerance to lactose. Okay, so food allergies, about 1%. In children, it's about 7%, although some children outgrow their allergies. Okay, so food intolerance is way more common than food allergies. And so they are, if you've ever eaten something that doesn't agree with you, for me, the most recent thing that I ate was little beef sticks. And after I ate them, I got sick. And then I was looking at the package and there was mold on them. So I don't think I'm intolerant to beef sticks. I'm thinking I'm intolerant to eating food that has mold on it, right? Okay, so there are certain things that you eat that make you feel bad. And everybody knows, for the most part, what those are, right? And if you don't, you just haven't eaten enough different kinds of food. So overall, food intolerance, probably, we're going to say maybe 20%, perhaps 30% of people will have some type of food intolerance. So it would be handy to know what those are. Well, there's a way to do that. Okay, so let's talk about the comparison. Food allergy, food sensitivity, we haven't talked about. Food sensitivity is also sort of an immune response, but a different immunoglobulin, and then food intolerance. So food allergies involve IgE, immunoglobulin E, the same thing that I fight off with this seasonal allergy thanks to living in Oklahoma for 10 years, 9 years. I never had seasonal allergies until I moved to Oklahoma City. And Oklahoma City is the second worst seasonal allergy city in the country. So everybody told me when I moved there, you will have seasonal allergies if you live here long enough. That's true. I mean, I live in Missouri, which has tons and tons of different kinds of trees. Never had an allergy until I moved to Oklahoma City. So IgE is involved with food allergies as well. Food sensitivity, immune system response with immunoglobulin G, and some other antibodies, white blood cells, and other immune system molecules that are involved in food sensitivity. However, food intolerance, no immune system response. So usually it's an enzyme deficiency or it's poor absorption of certain carbohydrates. You've heard me gripe about carbohydrates before. Most of these food intolerances have to do with different types of carbohydrates. So when I tell people that are trying to control their weight eliminate carbohydrates or reduce them significantly, a lot of times the food intolerances that they may or may not know about, they start feeling better just because they're not eating those types of carbohydrates. Okay? So examples, the types of food that cause food allergies. The 8 most common are milk, eggs, peanuts, tree nuts, wheat, soy, fish, and shellfish, like we talked about. Food sensitivity varies. Okay, so that can be from person to person. May include some foods that you eat fairly often. And then food intolerance, usually milk, legumes, certain vegetables, fruits, grains, sweeteners. Sweeteners is kind of a big deal. One, they're not good for you, just like sugar. Sugar is horrifying. Fake sugar, I think I told you 2 months ago that if you drink 2 aspartame-containing drinks, like Diet Coke or whatever, you increase your risk of death from all causes by 46%, just having 2 a month. Do I do it? Yes. Should I not? Yes. Should none of us do that? Yes. Sugar is actually worse. Okay, onset of symptoms. So if you have a food allergy, how long does it take for you to have a reaction to it? Well, the food allergy, it's rapid. It usually happens within minutes. So you might get hives, you might start having trouble breathing, whatever. Food sensitivities might take a few hours. Food intolerance, usually 30 minutes to 2 days after you eat something that your digestive system doesn't really like. Okay, what are the examples of symptoms? So food allergies, usually trouble swallowing, so your throat can close up and swell up. Trouble breathing, some nausea, some vomiting, hives. You can get anaphylactic shock. So it's really a life-threatening thing. If you have a food allergy, you need to know that. There is testing available, but I'm assuming that if you have a food allergy, you have eaten something that has given you an allergic reaction and you don't eat it. But there's a way to test for it. Food sensitivity, usually headaches, joint pain. There can be digestive issues, skin issues. Overall, you just don't feel well. Okay, so that's a food sensitivity. Food intolerance, most common is digestive because it's a digestive system response. So you bloat, you get excess gas, flatulence, you fart too much, basically. Gut pain, diarrhea, constipation. So how many people have that kind of thing? Lots. So once again, there is a test for food intolerance. And we all know, well, there's a normal physiologic response called the gastrocolic reflex, where people will say, well, I eat and it passes right through me, I have to go to the bathroom. Well, that's not quite true. That's a gastrocolic response. So you eat, there are enzymes that talk to your colon talks to your stomach and your brain, et cetera, et cetera. And there's a lot of people that have to go to the bathroom just because they've eaten anything. It doesn't mean that it has to be a food intolerance thing. But there are food intolerances that will live with you for a day or two where you just feel bloated and full. Any of you that are intolerant to certain things and know things that you shouldn't eat, but you like them and you eat them anyway, you're going to pay the price, right? Okay, so the amount of food that is required to give you that response, well, with a food allergy, it's not much. Okay, so if you truly have a peanut allergy, if you eat 1 peanut, you're going to be in trouble within minutes, right? The sensitivity thing, variable. And then typically with a food intolerance, you get worse symptoms the more of the intolerant food that you eat. Okay, so that makes sense. So if your body doesn't really like it or your digestive system, you might get by with a little bit, but the more you eat, the more symptoms you're going to have. So how do you test for it? Well, we'll get into that here in a little bit, but for allergic testing, there's little skin pricks. You've seen probably pictures of people getting a little needle stuck in their arm. So there are skin prick tests for food allergies and allergies to trees and environmental stuff, etc. For food sensitivity, lots of tests. Validity validity is kind of uncertain, and that's true for food intolerance as well. Fortunately, some of the food intolerance tests have come down in price. It used to be if you wanted to do a real food intolerance test, it's going to run you about $1,200, not covered by insurance most of the time. There's breath tests, there's blood tests, there are hair analysis tests. Okay, so the prevalence of food allergies, 1 to 3% of adults, 5 to 10% of children. Most of those outgrow. Most children outgrow their food allergies, not all. And then food sensitivity prevalence is uncertain, but suspected to be a common thing. Okay, and then food intolerance, where your digestive system just doesn't like it. That's about 20%, 15%, 20%, so we'll say 1 in 5 people. So that's a huge amount of people, right? Okay, so what are the reactions to food intolerance? Before we do that, let's talk about food aversion. So there are food aversions, and that has to do with eating disorders. So a significant eating disorder person just is averse to all food, right? But food aversion, if you go back in the psych literature and the psychologic history, it's a Pavlovian response. So Pavlov's dog. So there are people that are averse to certain foods just because they think they're gross, right? When I was a kid, there was all kinds of stuff that I was averse to that by the time you're about 30, you start eating them and you realize, oh, well, mom and dad were actually right. This is good. So Friday night, I was in Midtown St. Louis down on the hill eating calamari. So if you would have fed me calamari when I was 15, I wouldn't eat it first. So that's a food aversion. And now I'm almost 60, and I think it's like one of the greatest things you can eat. Kind of like broccoli. I hated broccoli. And then when you turn 30, kind of like everybody hates broccoli when they're a kid. And then you realize when you grow up that broccoli is actually pretty good, depending on how you fix it. So there's food aversion, that's Pavlovian. Okay, so think about the salivary response of Pavlov's dog. Okay, so what are the symptoms? So cellular reactions to food and chemicals and other substances can be from both acute and chronic illnesses. Okay, and there's an association between the immune system, especially if you have an allergy. So if you have an allergy to food, you need to know that because you shouldn't take it. You shouldn't eat it. It might kill you. And then there's inflammatory responses, development of chronic disease. So if you keep eating stuff that you're intolerant to, you're just adding to the inflammation that your body is having to put up with, and eventually it just gives out and gives in to the chronic illnesses and diseases that the pharmaceutical industry would like to sell you tons of pills to do or to take care of, right? And then there's development of the chronic illness where perhaps you are beholden to the pharmaceutical industry. Okay, so what are the symptoms? Gastrointestinal, meaning diarrhea, constipation, bloating, irritable bowel syndrome. They've studied that a lot. Gastritis, so inflammation of the stomach lining. Remember, you get a new stomach lining every 3 days, so if you could avoid that, you got a brand new stomach lining 72 hours later. Reflux and associated nutritional deficiencies because you're not absorbing certain things that you need. There are also skin symptoms. I think I put up a little pie chart last week about all the symptoms that can be associated with food intolerance. So go back on Facebook on my page, and you can look at this pie chart. All the things that can come about from having food intolerance that you may not know about, and you continue to eat, and then wonder why you don't feel good. Okay, so skin symptoms. So dermatology, eczema, psoriasis, rashes, keratosis, urticaria, which is itching, acne. So adult cystic acne can come about because of hormone imbalance, but one of the things we talk about with clients is, what are you eating? What is there possibly that you're eating that may be causing adult cystic acne? So you test those people to try to figure out, okay, is there something you're eating that's causing that? Okay, neurologic symptoms. So migraines. You know, how many people you know that have migraines and have to take meds and they can't, you know, they're in bed 2 days a month. I've talked with so many people who just basically are laid up for 2 days a month. And if that's in the middle of the work week when they're supposed to be at work, that's kind of a problem, right? So just headaches in general, memory trouble, so the brain fog that we talk about, chronic fatigue, mood swings, depression, ADHD, adult or attention deficit disorder in adults and children, neuropathy, cognitive impairment. I just can't think my way through anything. It's not always Alzheimer's disease. That's what everybody thinks it is, but sometimes it's what you're eating. Respiratory disease, chronic cough, like what I do, when I do these Facebook lives. I think mine are seasonal allergies, especially now I'm back in Missouri. I'm not used to the Missouri tree stuff, and there's lots of trees in this state. Wheezing, bronchoconstriction, sinus drainage, metabolic and endocrine disorders, so obesity, diabetes, metabolic syndrome, insulin resistance, inability to lose weight. How many people do you think I talk to that want to lose weight? Most of them. Weight loss. So there can be weight, you know, you can gain weight from this, you can lose weight from this. Thyroid trouble. 50% of women over 40 years old have thyroid dysfunction. It's worth the test just to figure it out, because there's, you know, the thyroid is the accelerator of your body. Infertility, irregular menstrual cycles, okay? And then stiff and sore joints, arthritis, tendonitis, you know, pain in the tendons and the joints. And then the immune system. So you have less of a chance of fighting off maybe COVID-19 because of what you're eating. Infections, allergies, autoimmune disease, heart trouble, progression of tumors, so new growths, basically. Okay, so how do you diagnose it? Well, if you look at the literature, it basically says that, I'll just read it to you, adverse food reactions are defined as any abnormal reaction following the ingestion of food. Well, that's pretty general, right? So most of the time, if you go to get diagnosed for a food intolerance or a food allergy, and most of the time you can figure out a food allergy, eat something, you wind up, you can't breathe, you can't swallow, you swell up, you have hives, all that. But a food intolerance is a little bit hard to diagnose, so what you have to do is eliminate. They do it by elimination. And if you do elimination, you basically just have to eat really basic stuff and then reintroduce things one at a time to figure out what you're averse to. Okay, so not real scientific, but that's how it's done. To diagnose a food intolerance, you have to eliminate all things that cause food intolerances for, I think it's like 2 to 3 weeks, maybe even 6 weeks, can't remember. But basically, then you reintroduce each thing and you find out if you have symptoms to that or a reaction to that, and then you don't eat it. Okay, so we have all these medical tests, we have all this, we have, you know, the medical system in general. And that's basically the best they've come up with as far as diagnosis and treatment. So it makes sense that the treatment would be to not eat stuff that gives you intolerance or sensitivity, and certainly not allergic reactions. But surely you should be able to figure out better how to diagnose this. What am I really intolerant to? So we're going to talk about testing here in a minute, but the sensitivity, so non-allergic stuff, sensitivities and intolerances. They talk about FODMAPs, F-O-D-M-A-P-S, which stands for, you ready? Fermentable oligodimonosaccharides and polyols. Well, that's just gross. So basically, you get put on a low FODMAP diet, so you're eliminating all that. It reduces intake of carbohydrate subgroups, and there's 5 of them. 1, excess fructose. So when you read food labels, if there's something in there that says high fructose corn syrup, don't eat it. 1, it might be an intolerance. 2, it's significantly nasty and bad for your health overall. Okay, so when they're talking about on the FODMAP, the excess fructose, they're talking about honey and apples and mangoes, which sounds like they would be good, right? But some people aren't tolerant to those. Number 2, lactose. So milk and yogurt, if you have a lactase deficiency. 3, polyols, usually sorbitol and mannitol, which is in avocados and pears, okay? And number 4, fructans, which is present in wheat, onion, and garlic. And so we haven't even gotten into gluten sensitivity. So you hear a lot of, elimination of glutens in your diet. There is a certain condition called celiac sprue, where those people cannot tolerate gluten at all. That's technically an autoimmune disease. Well, not technically, it is an autoimmune disease. There's a blood test for it. It tells you whether or not you got it. And so you'd have to ask your doctor, can I have a celiac sprue blood test? I mean, it's a thing. You can do it. But most people are intolerant. Okay, number 4 was fructan. So that's wheat, onion, and garlic. And thankfully, I don't have a garlic intolerance, because I put garlic on everything. Everything you cook tastes better with garlic, except cake, and that's arguable. And 5, galacto-oligosaccharides present in legumes and nuts. Okay, so that kind of fits the pattern of intolerance and allergies and sensitivities, etc. Okay, so basically, if you have intolerance, they put you on that type of diet, usually with a nutritionist, and then they reintroduce and figure out, okay, well, that person can't handle this subgroup of those 5 on the FODMAP diet. And that way you can sort of figure out what you're doing, okay? Okay, testing. So I've used the ALCAT test before. The ALCAT test is expensive. I mean, it's been expensive. And ALCAT stands for allergic leukocyte or antigen leukocyte antibody test, I think, or antibody leukocyte antigen test or something like ALCAT. It's been around for a while. We used to do them a lot. They were $1,200. I think they've come down. And it basically tells you what not to eat. It's pretty simple. It's really kind of determines what foods and substances can trigger inflammation and related symptoms. So it's still around. I'm looking at Cell Science Systems, who offers the test. If I click on this, let me see if it says request a kit. It won't tell me what it costs until I sign up to actually get the kit. So it's debatable whether or not the ALCAT test is reliable, true, etc. They do manage to mention that researchers at Yale School of Medicine have correlated the ALCAT test results with well-known immunological markers of immune activation. So ALCAT is really kind of looking at what you're allergic to. And if you eat something you're allergic to it, you're going to figure it out. What's more important really is what you're intolerant to. Maybe what you're sensitive to, but you can probably figure that out. So food intolerance would be nice to know. And there are several hair analysis-based tests. So the ALCAT test is a blood test. But there are hair analysis tests that will tell you what you shouldn't eat because your body doesn't like it. And those aren't $1,200. As a matter of fact, there's one of them right now that is running about 70. I think they're usually around $100-ish to figure out food intolerance from hair analysis. So you basically pluck a hair out and you send it to a lab, and they tell you based on your hair analysis what you shouldn't eat, right? Haven't really seen like a urine test, etc., or whatever, but there is blood tests, there's hair analysis tests, and they keep coming down in price. So if you're wondering if why you feel yucky is from what you eat, you just do that test and it'll tell you that. So that's the basics, and I am not an allergist, I'm not really a nutritionist, etc. I'm just putting this out there so that you know that sometimes what you eat can make you feel ill. Doesn't mean you are ill, but if you're intolerant to certain things, it would be handy to know that so you can avoid them. Unfortunately, a lot of times people are intolerant to stuff that they really like to eat, but they pay for it, and everybody's gone through that. Every time I eat this, I get, it takes me 2 days to get through it, but it's so good I'm going to eat it anyway. I get it. But there's testing available. You can eliminate. If you can figure out what you're intolerant to, you can eliminate it. And that's basically, if you look in the medical literature, it's always eliminate everything and then reintroduce it and figure out what you shouldn't eat. That seems kind of goofy to me, but that's the best they got in the NCBI and the National Institute of Health literature is eliminate stuff and reintroduce it. Okay? Whether or not a food intolerance test is reliable, most people think in the medical realm that they're not, but it's at least somewhat semi-scientific for you to do a test and figure out what you're intolerant to, as opposed to eliminating everything and then reintroducing. That's, to me, not very scientific either. Okay, so it's a new week. It's nice outside. We got some rain this weekend, so that was nice. And I hope you all have a great week. Peace and health to all of you. I'll talk to you Wednesday. I haven't decided what I'm going to do Wednesday, but I'll let you know. Okay? Okay, have a good day and a good week. And I'll see you Wednesday at 9:30 Central Time. See ya. Bye.